Good afternoon, teacher. My name is Emily Peña Salazar. My topic is transplanting hepatitis C positive cases. Definition: hepatitis C is an important medical health problem in kidney transplant patients, and it has a negative impact on graft survival. The degree of liver disease prior to transplantation and the immunosuppression administered are the two main prognostic factors in the course of the infection. It is convenient to optimize the diagnosis and treatment of hepatitis C cases included in the kidney transplantation program to increase the group of recipients and avoid the presentation present in the post-transplant period.
In the expander study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
Application in nursing. The immunity period is critical. The patient must be closely and constantly monitored until that the main effects of the anesthesia have disappeared and the general conditions stabilized. During this time, accepts must be strictly understood. Next, write down all the equipment that the patient is wearing on the nursing chair: serums, probes, bladder nasogastric, drains, content and quantity, examining circulatory status, TE, FC, PVC, TE, FR, color of the mucosal members, respiratory status, monitor patients on the airways. They can be obstructed by the tongue or due to accumulations of secretions. Neurological status, welfare, control of nausea and vomiting, eliminations, monitoring of diuresis, follow medical orders to replace it. Pros and cons. No more dialysis treatment, greater freedom, less dietary restriction and leakage, greater chance of living a life longer. A more normal kidney functions requires major surgery while reach possible relative surgery. You must take anti-rejection medication for the rest of your life or the life of the kidneys. Increases risk observations arising from these medications and risk of rejection while loss of kidney functions return to dialysis. Issue application in Ecuador. Ecuador in the last 3 years registered an increase in the number of donor transplants, and it is due to the finances of the state and the solidarity of the families who decided to respect the will of the deceased person expressing in their in life and the permanent training of the teams on first place. In conclusion, kidney transplantation is performed in patients with advanced kidney disease. Depending on the source of the receiving organs, the kidney transplant is typically classified deceased donors or a live donor transplant.
Like yesterday, the day before. Oh yeah, we do have bears up here. It reminds me of Night of the Living Dead, believe it or not. You see how the zombies are walking towards you? That's exactly what they look like coming out of dialysis. I'm not kidding. Here we go. Say hi. The concept of getting a very good kidney with small traces of the virus and then getting treated for the virus that's curable, it just makes sense to me. Maybe.
That would be good.
Oh, that's
It'll
funny.
be there all year round.
I was thinking of putting it on this side. I can attach it.
More sane. So
If they didn't have this study, I wouldn't be where I am today. So I'm extremely grateful. Because I have nothing to complain about.
Believe me, I'm really
I
happy
mean, it's
about
so
it.
weird. I feel like I'm such a bad patient.
Bye back. We're giving them the opportunity to have a transplant, but we're also treating them for a new infection that they didn't have. So that's the trade-off.
Are you ready?
There's a whole pool of kidneys that we just kept looking over. It was like we had blinders to it.
And unfortunately, if the numbers keep increasing, the number of available organs that we could use might actually continue to increase as well.
Thank you.